Hello everyone. Today we will be learning about the foodborne illness, Shigella. Come with me as we investigate. What is this? Oh hey, I didn't see you there. Today we are going to be talking about Shigella dysentery or Shigellosis, aka Shigella. It's a bacteria that you get from eating nasty food.
Shigella is spread through feces on the hands and poor sanitation before preparing food. Shigella gets into the feces, and then once the feces is touched, and then food is touched or water is touched, people get harmful effects from the bacteria.
Tastes like Shigella. Shigella is also transferred through water. Shigella can be transferred through food and non-thorough hand washing. I don't want to eat it.
Yeah!
Tastes like Shigella.
Why?
I feel like I have a fever and my abdominal pains are the worst.
Diarrhea.
Shigella lasts for about a week.
It doesn't go away on its own in a week. Doctors may prescribe antibiotics.
Even though most Shigella cases clear up and bowel movements return to normal after a few months, 2% of Shigella patients have long-term effects such as joint damage, irritation of the eyes, and painful urination.
Oh, my joints. Oh, my eyes.
Go.
Breaking news. Shigella, third most common foodborne illness in the United States. Shigella mostly affects young children ages 2 through 4 because of the poor hand sanitation before eating. Center of Disease Control reports 17 through 20,000 cases average annually, but most of them go undiagnosed.
Go.
Shigella outbreaks mostly happen in developing countries, within poor sanitation of water and food.
Shigella fun fact. Shigella is often contracted in a daycare setting because when feces that is infected is touched, the person can get the bacteria if they ingest anything with their hands or anything that touched the feces. So a lot of times in daycares, Shigella outbreaks will happen. Shigella outbreaks are being prevented by doctors prescribing antibiotics to infected patients, careful hand washing, and drinking only treated water. You can help at home by making sure your kids wash their hands, making sure you wash your hands, and making sure everyone that touches food washes their hands before they eat. The government is taking control by making businesses have sanitation checks and making their employees wash their hands before returning to work.
Reporting live from Japan, 100 years in the past, Dr. Shiga.
I discovered microscopic living organisms, Shigella, and named them after myself.
We've interrupted your regularly scheduled televised program to bring you a message from Chris, the master of knives.
Welcome to Cooking with Chris. When you're in the kitchen, you gotta remember kitchen safety. Make sure all the knives that you handle are sharp, but you use caution with care. But today this knife isn't so sharp, so we'll try to make it work. Oh no, that wasn't safe enough. That could happen to you.
Avery Miller playing Dr. Shiga.
Chris Gabor playing the Knives Master.
Bork playing the reporter.
Shigella
rhymes with salmonella,
but
but
it's
it's
not.
not.